Pregnancy can be one of the most exciting things a woman can experience. And as exciting as expectant moms can be to see their new bundle of joy, you don't want your baby to come too early. So how can you tell the signs of premature labor? Here to help us out is Dr. Nithya Gopal, OBGYN at Well Health Women's Specialty Care. Welcome, doctor.
Thank you for having me.
Yes. All right. So first, let's just talk about what a regular term for pregnancy is. Usually people say 9 months, but in fact,
It's closer to 10 months.
Okay.
When we are talking about premature babies, any baby born before 37 weeks is considered premature. So 40 weeks is a full term up to your due date pregnancy. So any baby born 3 or more weeks before their due date is considered premature. It's important to understand that a baby born premature is going to be at an increased risk of serious health concerns. And the more premature they are, 28 weeks, 32 weeks, you have serious health concerns like infection, developmental delay.
Can I ask you, yes, on that note, so you're worried about the health of the baby primarily.
Yes.
And how often is a baby born premature, on average?
On average, there are upwards of 380,000 premature deliveries every year. And this number is declining significantly, and that's in part because patients are becoming more aware of the signs and symptoms that can develop in your body's way of telling you that I might be going into labor early.
Ooh, that's very interesting. Let's talk about some of those signs and symptoms. I would also think partly you're in the medical profession,
Yes.
so it has to do with advances in medicine as well.
Absolutely.
Right? Doctors like yourself being able to communicate what some of these signs are that women should look for.
Right.
What are these signs and symptoms?
Typically, the big red flags are going to be crampy, menstrual-style abdominal pain that occurs every 10 minutes or closer together, and that becomes more and more severe as the hours progress. Additionally, you want to look out for leakage of fluid from below, increased secretions, pelvic pressure, pain that starts in the back, radiates to the front. These are your telltale signs. And if there's ever any concern that you might be going into labor early, specifically those women that have a history of previous premature delivery and previous pregnancies, these women are going to be at increased risk of premature delivery and subsequent deliveries. So it's very important, if you ever have a concern about your body and what changes are going on, that you pick up the phone and call your doctor or go to the nearest emergency room.
Hey, you know, and I've had friends who, in their first pregnancy, the last few weeks, they're going to the doctor twice a week. Now, not necessarily because there's something wrong, but they want to just be sure that whatever is happening is normal.
Absolutely.
There are ways that a woman can reduce the risk of premature labor, reduce the risk of these symptoms. What are some of those ways?
Right. The most important thing I tell my patients who are trying to get pregnant or thinking about conception is that once you have that missed period and get that home pregnancy test that's positive, you should get into the doctor's office and see an OBGYN or a midwife as soon as possible. And going back to what I said, this is especially important for women that have a history of premature delivery. Close surveillance at the beginning of the pregnancy can prevent an early delivery in this pregnancy. Sometimes it requires medications, close surveillance with sonograms, but getting in as soon as possible is the key. Starting on prenatal vitamins as early as possible, common sense measures, reducing and eliminating cigarette smoking, alcohol use, reducing physical and emotional stressors is a key. And those measures can go a long way to preventing early deliveries.
It's really interesting. Is this something you speak to any woman who comes in early in their pregnancy about, that this could be something to watch for?
Absolutely.
Yeah.
Absolutely. Even though the number is declining of premature deliveries every year, we need to educate our patients. They need to know the signs. And it's surprising for a lot of them to know that emotional and physical stress can precipitate an early delivery.
Oh,
so
I can imagine.
A healthy, well-balanced diet, a little bit of cardiovascular exercise if your doctor recommends it, and eliminating those physical and emotional stressors can go a long way.
Now, if a woman, if a set of parents do give birth to a baby prematurely, what are the things they need to know? What can they expect?
Right. It's undoubtedly a very stressful and scary time for new parents of a premature baby. If it's determined that the baby needs to go to the neonatal intensive care unit, it's very important that the parents have a clear and open line of communication with the NICU team of doctors and nurses. In general, NICU teams across the country are the most empathetic, compassionate, and well-meaning doctors out there, but it's incumbent on parents to really take an active role in understanding the conditions that their babies are going through, so that they can be comfortable with the decision making and the treatment options and more in control of the situation. And that's very important.
Absolutely. And then, once the parents are able to bring the baby home after the NICU experience, what do you think is important for parents to watch out for?
It's always an exciting time when they're finally cleared to go home.
Yeah.
But that being said, that they'll be parting with that team of NICU doctors and providers who were so important in that critical time in the baby's care. So the care doesn't stop once they leave the NICU to go home. They will undoubtedly have a lot of close follow-up that needs to be done, and that also means that limiting the amount of time that friends and family can come in and play with the new little one. So there needs to be some guidelines and restrictions at first when they come home.
And I'm sure each baby is its own individual situation, isn't it?
Yes.
Thank you so much for
It's a
this
pleasure.
great information.
Thank you for having me.
For more information on all you just heard and to schedule an appointment, call the phone number or visit the website on your screen. Well Health Women's Specialty Care is also on Facebook and Twitter.